There's an issue that a lot of people in Texas have had upon their mind as we work our way through responding to the coronavirus, and that is, what is the capability for hospitals across the entire state to be able to meet the needs of people in whatever region they may live in to access the health care they might need in the event they need to visit a hospital. One way that we were able to increase availability of hospital beds was with my executive order that required postponing non-essential surgeries and procedures that are not immediately medically necessary. In addition to that, I provided a waiver to hospitals that allows them to have double occupancy as opposed to single occupancy in bedrooms that would accommodate such expansion. Also, I have made some waivers that will increase staffing. As of today, we have 19,695 hospital beds available if they were all needed to treat people with COVID-19. And so on this next slide, it shows the total available beds as we speak today, the total number of reported beds that exist across the state of Texas, the percentage of beds in Texas that are vacant right now in the event that they needed to have someone occupy those beds who contracted positive for COVID-19. Importantly, also, we have more than 2,000 ICU beds that are available, and a lot of people have been interested in finding out about. We have identified 8,741 ventilators that are available to be used for those who may need them because of COVID-19.
This slide kind of shows how we categorize the availability of beds out there. The beds that the governor has referred to already and that I will run through in this presentation are all in the level 5 green box. If you were to walk into a hospital today, there would be beds there would be equipment there, and there would be staff there, nurses, other individuals who take care of the patients. The level 1 is the area that there can be some very, very significant opportunities for us. These could be hospitals that perhaps have been closed up for some reason, and they need to be sort of reinvigorated and brought back online for a short period of time. They can be the hospitals that are set up by the military. We've seen some of those in New York. We actually have about 2 of those set up. We have one up in the Dallas-Fort Worth area called FMS, Federal Medical Stations. 250 beds that are up there in the K. Bailey Hutchison Convention Center. There's actually, similarly, about that same number of beds set up in the Freeman Coliseum in San Antonio. And then Houston will be setting one up in NRG. That doesn't include the numerous number of hotels that are available out there. The hotel-motel industry has really come forward and saying, look, we're here to help you. You know, if you need to use our facilities, let's see what we can do to make those happen. And so that's what you're going to see in kind of the level 1. And again, at least it's our vision that these are probably going to be settings where patients are getting over their condition. They don't require the really high level of care that you're going to see in the hospitals and in the intensive care unit settings.
As it is clear from what Dr. Zerwas was talking about, that we are fully prepared for the hospital needs of Texans as we continue to respond to the coronavirus in the state of Texas. We have the capacity to add even more beds as are needed in regions that may increase in patient needs. And our capacity should prevent us from facing the type of situation that New York is having to deal with today. We as a state must ensure that everybody in our state is doing everything we possibly can to slow the spread of the coronavirus. It is in your best interest, for your own life and for your own health, for you to stay at home. You have the ultimate control and the ultimate ability to make sure you protect your life, and in doing so, make sure that we slow the spread of the coronavirus in Texas.